So, furthering the discussion of environmental based injuries, you look at heat exhaustion and heat stroke. So, to kind of compare and contrast, you look at what basically occurs. So, heat exhaustion is essentially an advanced form of dehydration where the body temperature does begin to continually rise a little bit. The thing to be mindful of when treating heat exhaustion is that it can progress to heat stroke. So when we look at what the differences between the two are, heat stroke involves extreme body temperatures and it involves an inhibited sweating mechanism. So basically at the point where somebody has heat stroke, their thermoregulatory system has basically stopped working, period, and is no longer happening. So you get that continued rise in body temperature, which is going to gradually cause more and more issues with the body. Some of the different things that could come of that, one is rhabdomyolysis, which we had talked about previously, where you get that catabolic destruction of muscular tissue and you get the leaking of the myoglobin, or the cells associated with that into the circulatory system and ending up causing damage to the kidneys. And if not treated promptly, heat stroke can obviously cause death. So when, again, to go back and look at your signs and symptoms chart, note the key signs and symptoms that would differentiate between heat exhaustion and heat stroke, because obviously the urgent treatment of heat stroke obviously becomes a very important thing to consider in your initial management of heat illness. Heat syncope. So, syncope is basically passing out, and you typically see this a lot of times with athletes, particularly in the first few days of activities, if their bodies haven't yet adjusted to the more intense type of activity that they're doing in practices. And what this is a combination of, it's a combination of vast peripheral dilation, so all the blood vessels in the periphery dilate, hypovolemia, or just a decrease in fluid in the body, and dehydration. And what that ends up causing is a lack of blood flow to the brain, because now, again, if all those vessels dilate, you have less fluid in the system, it's going to, obviously, you're not going to have enough blood in certain areas, again, most particularly the brain. And you see this a lot of times, particularly in individuals who stand for a long time and they stop exercise abruptly. It could also happen going from rapidly standing from sitting in athletes. So a lot of this, again, very early on, again, anytime you would be unsure as to why an individual would lose consciousness, you obviously, if you're unsure, and you have to go and make sure that they get further testing done. But look at the management of this, and you could kind of see some of the signs and symptoms. Again, it's a relatively benign thing, but again, if you're unsure, make sure you treat appropriately. Hyponatremia is a little different. What happens with hyponatremia is actually a decrease in sodium levels in the body. And you commonly do see this during more prolonged activity. It's a very common thing to see in like marathon runners, various types of distance running. And the issue of concern here is that if their blood sodium levels drop, what that causes is it causes the fluid and the water to move from the vascular system into the tissues. So the tissues basically get engorged with fluid, and this causes a lot of issues, particularly with the nervous system, so that gets to be a concern there. And usually the reason why this happens is you get individuals who will hydrate themselves excessively with plain water. They also call this, they also sometimes term this water poisoning, because they basically hydrate themselves so much with water that it causes their sodium levels to drop. And again, you usually see this in, again, more endurance-based athletes. So you have to take this into consideration, because you can't treat this the same way as you would a heat illness. Obviously with a heat illness, you try to, obviously as long as the person's conscious and everything, you do try to help them hydrate. Well, obviously you can't do that with hyponatremia. So again, compare and contrast some of the signs and symptom differences between hyponatremia and heat stroke, because again, there are some subtle things that are different. Again, a lot of the presentation's the same, but note some of the subtle differences because it's going to impact your treatment of individuals when they have this. So some notes about heat illness prevention, some various things that can be done to assist with preventing this. So acclimatization is really important, and what acclimatization is it allows the body, allows the cardiovascular system, the circulatory system to kind of prepare itself to do aggressive activity in the heat. So it allows the sweating mechanism to become more efficient. It can start to begin in several days. So again, you would want to do the first couple days relatively low intensity and build up. It takes at least 2 weeks. And in some instances it can be longer, but they say you need at least 2 weeks of this to really have the sweating mechanism to become efficient and to have the cardiovascular system adapt to what it is they're doing. Some other notes of this, and obviously correlate this with what you see in the reading, but avoiding exercise during the hottest parts of the day, so in the middle part of the day. Save the high intensity stuff for the really early mornings and maybe towards the evening. Appropriate clothing, so look at what would be appropriate clothing for heat illness prevention. And then obviously nutrition and hydration, both before and during activity. So a couple things to note. So look at the pre-hydration guidelines and what that means for activity and what you want. And also look at your book brings up what they call the 3% rule. So if you do weigh-ins, which is a very good thing to do, so athletes weigh in before practice, they weigh in after. And so as athletes lose weight, so if they're losing weight during practices, they're obviously losing weight because of fluid loss. So what you want to do is, if an athlete loses 3% or more of their body weight during an exercise session, they need to make sure that gets replaced. If that doesn't get replaced, they should really be withheld from practice, because at the point where they've lost 3% body weight, again, that's going to be all fluid loss. So they lose 3% of their body weight and they don't get that back, they're really putting themselves at risk for significant heat illness. So that would be something to be mindful of. Make sure that they're replacing that lost fluid with the recommended amounts. So with frostbite, now frostbite is discussed in your book, in your textbook. Frostbite is not discussed in the endocrine system. I'm going to talk about it here just because we're talking about all the other environmental injuries, environmental issues here. So it is in the dermatological chapter, which is going to be included with this material for the testing anyway. So we're all talking about it at the same time. So if you want to look at the reading, include this in your signs and symptoms chart for the endocrine system. Just go into the dermatological chapter, which is the chapter on the skin, which, as I said, we're going to be doing anyway, and look at your material for that. So frostbite, again, is something that can be something that progresses over time. And again, everyone's been out in the cold at some point in time, so this is probably, even though you haven't ever experienced deep frostbite, you maybe have experienced some early signs and symptoms as the tissue starts to cool. So it begins as paresthesia, so some numbness, and blanching, known as frost nip. So this is something that is very easily reversible. If you look at the picture, you can kind of see like what goes on with the different levels of tissue freezing. As the upper layers of the skin start to freeze, you get superficial frostbite. So this is where you're actually going to begin to get, you literally get ice crystals starting to form in the extracellular spaces. So the fluid that's in there actually does start to freeze. And then as it progresses, you get into deep frostbite. So the picture kind of illustrates this pretty nicely as far as the different layers of skin and soft tissue that begin to be affected as you go deeper and deeper. Again, very important, look at the steps again, as with any other condition, for treating this, okay? Particularly with deep frostbite. Deep frostbite requires very rapid rewarming to make sure that you do not have damage to tissue. And usually that rewarming does cause a lot of discomfort, because as the circulation gets restored, it does start to cause some discomfort, but it's very important to save the tissue to make sure that that deep frostbite gets reversed. So frostbite is more of a local injury that occurs in the cold. Hypothermia is more systemic and is much more serious. So if you have somebody who is suffering from hypothermia and frostbite at the same time, the treatment of hypothermia takes precedence. So you have to treat the hypothermia first because of the systemic consequences to that. So once core body temperature drops below 94 degrees, you start to have changes in a lot of the physiological processes of the body. So the metabolism will drop significantly. The blood viscosity increases, which basically means that there's a lot of resistance to circulation. A good way to kind of look at that would be like the blood almost kind of thickens as it cools. So that's going to produce a situation where there's a lot of resistance to blood flow. And then because of the decrease in metabolism, the heart rate and cardiac output is going to decrease. So it's very important, again, that this gets treated appropriately. We look here at some preventative measures. Obviously, the big issue here is a combination of cold and wet. So, obviously extreme cold by itself is a problem. When you have the combination, though, of cold and wet, that's where you start to be more at risk. Because when there's that moisture in the air, it does obviously impact the body much more significantly. And one of the things recommended is to wear layers out in the cold. So obviously don't wear big, bulky things, which most people who are doing physical activity in the cold aren't going to want to do anyway. But wear layers, because then obviously, like, sweat mechanism and everything else, and plus to, if a person does get warm, then they could obviously remove layers. Again, be very mindful of what has to go on treatment-wise for this, as this gets to be obviously impactful in the person's prognosis. So with altitude sickness, so particularly if if you do by chance happen to be working with a sports team and you do have to travel, you may travel to areas where there's significant altitude changes, and if that's the case, it's important, much like the heat, that individuals acclimatize to this. So usually you have different levels. So if you have rapid ascent, so basically meaning you just kind of go up in altitude and try to perform activity with it. So rapid ascent over 12,000 feet can begin to cause symptoms, and even rapid ascent to 8,000 can begin to cause some cerebral and pulmonary edema. So if you do start to notice in particular some neurological disturbances or breathing issues with athletes, that could be a concern even with rapid ascent to 8,000 feet. Over 15,000, you start to have issues with the eyes, where you can start to get retinopathies and even hemorrhaging in the retina if that happens. So very important that if you're ever in a situation, and it's not terribly common, it's not, I would say, common to have this a lot of times with a lot of your work settings, but you could be in a situation, and it is something to be mindful of. What causes this are various things. So there's decreased barometric pressure, which affects a lot of the body systems as you have this rapid ascent to these heights. There's also a decreased level of oxygen as you go higher and higher. You probably see this even with a lot of, even in sports teams, for instance. It's known in Denver, they used to call it Mile High Stadium, and teams would feel that, the decreased concentration of oxygen in the air, the decreased ambient temperature, higher sunlight intensity, and all of that can possibly predispose individuals to dehydration. Another thing to be mindful of are when you have individuals with sickle cell trait, they are at risk for sickle cell crises when they do this. So it could possibly cause a sickling event in individuals with sickle cell crisis with a rapid ascent to any one of these levels. So looking at obesity, a couple just important things to note from the reading. So again, note kind of some of the demographic information and how that's going to impact individuals. Essentially, the reason why just any type of significant weight gain would occur is because of sustained positive energy balance. So that's just a way of saying that an individual takes in significantly more calories than their body uses. So if they take in more calories than their body uses, obviously the body is going to store that and it will be stored as fat tissue. Some of the big things to note is look at the secondary health issues that occur from this. And we've talked about this in prior classes, particularly in the cardiovascular system and a lot of the issues related to that. Another thing to note for yourself is that there are different ways to measure body fat. So look at all of the different measures of body fat, look at the accuracy of those measures. So you have different things. You have the dual X-ray absorption or DEXA. You have skin fold thickness measurements. You have bioelectrical impedance. Again, all of them have their advantages and disadvantages. Look at what your textbook considers normal as far as body fat's concerned. And also look at BMI measurements, which, BMI gets to be a very difficult thing, or body mass index, particularly with very active individuals because of the way that that's kind of determined. So look at that, look at some preventative educational things that at least have been done or can work also as well to help in preventing this. Gout is a condition where the amino acid purine does not get broken down and eliminate it from the body appropriately. And what happens is you get a buildup of uric acid. And when that uric acid is not eliminated, individuals will start to deposit crystals in their joints and tissues. And you see on the picture here, one of the more common areas to see this is at the big toe, at the joints of the big toe. Very common to see gout occur there. It can happen in other areas. This is kind of just the more classic presentation where you see this a lot. And literally, if you look at that picture, so you look at the IP joint as they're showing there in the big toe, you can actually see the mass of crystals that have deposited in this joint. This is extremely, extremely painful when it happens. And there's various reasons why it occurs. Different types of medications can cause this to happen. Some people do attribute diet. It's kind of debated back and forth as to how much diet contributes to this. And they say like a rich diet, lots of meat, steak, things like that. They do attribute to this, and just people's processing abilities with that impacts it. But again, not quite sure if that's the reason why. But a lot of people who do suffer gout attacks, they typically do recommend changes in diet, making sure they stay hydrated appropriately and things like that to potentially limit the impact of further occurrences. Osteoporosis, and we had started talking about osteoporosis in the previous chapter when we were discussing the female athlete triad. So it's a decrease in bone density. Various issues are associated with this. So obviously hormone imbalances in particular, when you're looking at females, as it's much more common to see in females, nutritional issues, age. The biggest issue here is the predisposition to fractures. So bones, obviously, if their density decreases, it's going to put them at risk for fracture. You can kind of see the differences in the illustration on the slide here, kind of what the framework of what the normal bone looks like versus an individual who's osteoporotic. You may also hear the term osteopenia. So osteopenia is an initial loss in bone mass. So if you hear that terminology, that's what basically they're referring to. So that's the person that has osteopenia is progressing towards having osteoporosis. So the osteopenia is the initial loss of bone tissue. What we have to consider is, from our perspective, depending on the patient population and who we're dealing with, the types of treatments that we apply. So things like joint mobilizations, the exercises that we do for the individuals, and how we load them is going to change if they're starting to have compromised bone density in those people. And Paget's disease is an abnormality of bone remodeling. So under normal conditions, our bones are always remodeling. They're always breaking down, building up, kind of based upon stresses. In someone with Paget's disease, they get basically extremes on both ends. They get this excess deposition and in some cases reabsorption of bone at different times. And what it basically ends up doing is causing these very thick, very deformed bones. There's a picture, if you note the picture on the slide, you see this in the pelvis. If you notice on the left side, you have a normal pelvic bone, and the other one, it's kind of enlarged and deformed. You see kind of the areas where there's abnormal reabsorption of bone. And this normally happens in the long or flat bones. So here you see it in the pelvis, which is a flat bone. And it's very common to see in elderly men. Again, some of the different things, obviously, if the bone's not remodeling right, it could put the person at risk for fractures. So again, with precautions, it's very important that individuals with this don't do a lot of heavy loading, because, again, the bone is not going to be able to withstand those stresses because it's basically has not been remodeling appropriately. An osteogenesis imperfecta is also known as brittle bone disease. So this is something that many times is diagnosed in early childhood. So pretty much individuals with this don't really participate in athletics, because basically what happens is it's an inherited trait that actually causes an issue with bone formation. So basically it literally creates brittle bones that fracture very easily. So there are different forms of this. So there are more mild forms where individuals can, be a little bit more active, and there are very severe forms, and this many times put individuals, for instance, in wheelchairs. There's no cure for this, and most people end up getting disabled via having multiple fractures, because their bones basically fracture all the time. Typically, individuals with this do have their lifespan shortened, primarily because a lot of times they have to be very inactive. So obviously their level of inactivity contributes to that as well. Again, we look at treatment and management strategies for this. Again, it does get to be very difficult to treat, obviously, because of the fact that the individuals can't do really any form of physical activity. And just a summary of the learning outcomes. Again, the one of the keys with this is understanding the hormones and what they do. First of all, understand what they affect, the organs that they come from. Obviously, that would proceed into having a greater understanding of the different conditions and what they do. Again, note your signs and symptoms. For your treatment, make sure on your chart you're also including prevention as a part of that, which, for instance, with the environmental conditions, the prevention aspect becomes very important. So make sure that you include that as well.